government has provided an update on the Charlotte Maxeke Johannesburg Academic Hospital. In fact, I can tell you more on that story. It's been 10 months since a fire broke out in the hospital last April, causing extensive damage to the building. How has this affected the facility? Well, we've just had an update. Let's get reaction to it then. Professor Adam Mohammed is head of internal medicine at the Charlotte Maxeke Johannesburg Academic Hospital. Prof, thank you for your time. So in around December last year, you made a desperate plea as the professionals that see patients, especially in the internal medicine department, for President Cyril Ramaphosa to set up a national task team that would involve ministers of finance, of health, infrastructure development, because you were at your wits' end with the efforts of the provincial government. Well, it's not necessarily a task team, but the national government is taking over the project of restoring Charlotte Maxeke Academic Hospital. Are you happy with what you heard today?
So I would like first to thank you and all your audience. I think we're only getting here because of people's voices being heard, and that's because of media outlets like yourself. And I do like what I heard today. It's the first time we're getting somewhere positive. However, I'm not jumping up and down. The proof of the pudding is when the pudding is in front of the table and you have some of it to eat. I think it's 100% in a positive direction from where we were. However, I am very skeptical still because there was still no hard deadlines given. Are we going to have this conversation again in a month's time? I hope not. But what was very interesting is that they had a clinician from the hospital as part of this team, briefing the media, and he's not a politician, and I think he's going to look after the interests. And my only plea is for him to be part of this process going forward, rather than just government agencies doing that. There are some concerns relating to when will we get feedback, what has the accountability been for the last times. But my biggest issue is let's stop putting plasters over what we're doing. We're still in a crisis. CMJH is being attended to somewhat. Other hospitals are being in a crisis. And let's not be fooled. We're still giving suboptimal care to patients in Gauteng across all the hospitals, and healthcare workers and patients are not getting a good deal. Let's hold people accountable and give me deadlines.
Yeah, in fact, that key issue of the deadlines, I heard two dates being mentioned there. There was initially the date of 2027, but the project lead from the national government now is talking about 2023. But as you say, there aren't really any particularly firm deadlines. Why is that important? Is it because this is more of an emergency than actually it's being treated as at the moment?
The reason is because I've been down here with different departments, Department of Infrastructure Development, who came there and presented a program, gave me dates, or gave the clinicians dates when things were going to happen, and nothing came of it. So every time there was a deadline, it was moved out, there was some other excuse or something, and we know everybody doesn't meet deadlines. But this is healthcare, and I'm not really convinced about the budget, the definitions of how much budget will come from the development bank. What happens if we shoot across the budget? We've heard how Solidarity shot over its initial impressions because you're dealing with an old building. So we talk about fire remediation, excellent. We're talking about the other block that we're still waiting for structural assessment to be done, good. We're not talking about the maintenance of this hospital, which is being run down. Remember last year, November, the wards were flooded. We had to evacuate patients in the hospital because a main water line running on level 9 keeps on bursting. We're not addressing, we're just putting plasters over the holes, and we need to somehow have a holistic plan. I'm immensely proud and happy that national government and whoever the presidency has got involved behind the scenes, it's a positive way. But I'm sorry, I'm not going to take the foot off the pedal We're still going to hold you accountable, and I'm representing my staff, and we're going to hold you accountable with deadlines.
So speaking of that, then not taking your foot off the pedal, please, as a parting shot, please color in vivid detail for me this particular crisis. The departments we're talking about, it's your department, internal medicine, but I saw there, Prof. Mohammed, that among the other departments we mentioned is a department with which we've had a history in the life asset Dimania situation, in that one of the affected departments is mental health. There's oncology there, where people are possibly, falling behind in terms of their cancer treatment, etc., etc. Just color in vivid detail why this is an emergency and should be treated as such.
So the fixing of the hospital is a tip of the iceberg. The mental health care issues, irrespective that we're opening up 20 beds at the Johannesburg Hospital or 20 beds in Helen Joseph Hospital, is in a crisis in the last 3 to 4 years since Life Esidimeni. There has been no substantial input into mental health care users' access to treatment and quality care. The amount of money we wasted with these COVID hospitals and all these tenders and illegalities would have made such a big difference. You're looking at people sitting in casualty with a mental health from anything from 3 to 5 days, putting themselves at risk, putting other patients at risk, and putting staff at risk. And staff have been assaulted and hurt by patients with mental health issues. And it's not the patient's fault. They have an illness. But we don't have a mechanism of helping the most vulnerable patient. It's not only about Helen Joseph Hospital or Johannesburg Hospital. The same challenges are occurring at Chris Hani Baragwanath Hospital. There are cancer issues across the entire southern Gauteng. And it's almost being, and what's hurtful and heartsore for me to hear, how we are painting everything with such a nice light brush. It's unbelievable. I think we can do better. The ABT hospital at Barra has a potential to be an amazing hospital for dental health care in southern Gauteng. We can increase cancer care there, which has come out from a positive thing from the fire and from COVID. Again, we're not putting resources into that project to help those vulnerable patients. And Soweto is a massive population on our own. We need to reach out, and these should be parallel projects. I'm not just here representing CMJH. I'm here representing all the patients in southern Gauteng. Let's get up and do our work, and I'm going to watch.
All right. Thank you for your time and your inputs there, Professor Adam Mohammed, who is the head of internal medicine at the Charlotte Maxeke Johannesburg Academic Hospital, saying that there needs to be a holistic approach to fixing the infrastructure and maintenance problems and capacity problems around the health system in Gauteng. Let's stay with